Hi, my name is Andrew Callahan. I'm a physiotherapist. I have a vast interest in sport and exercise medicine. I'm a pretty healthy guy, and unfortunately over the last 4 weeks I have been floored with a virus and an upper tract respiratory infection called potentially COVID-19. I'm being asked by numerous people on a daily basis, which is great because people have been texting and phoning and saying, look Andy, how are you doing? How did you get it? How were you unwell? How long did it last? And loads of questions due to the fact that I've been involved in health and fitness for over 25 years. My hobbies are Brazilian Jiu-Jitsu. I'm a Brazilian Jiu-Jitsu black belt. I teach classes. I'm used to training with people who compete in the UFC and at higher level MMA. And over the last few weeks I've been floored. So what I've done is to, rather than sitting watching TikTok videos and learning new dances when I wasn't able to do anything, I have put my qualifications that I learned at my, at Glasgow Cali doing my masters to some use. And I've put some facts that I found in relation to medical evidence from journals. And I've also taken some research from different cohort studies and other types of studies and put it together. And basically this is also based on my own personal experience and my personal facts that I have looked at. And to help people, instead of me talking to people for 10 hours a day, every 30 minutes and texting me explaining it, what I did is to help myself, I've made a wee journal and a journey. So the last 20 minutes, take what you can from it and hope you enjoy. Okay, so you'll have seen my opening video. Here is my journey. This is my timeline and my symptoms from day one, my mild symptoms right through to on the mend. Here are my symptoms in the red. They're my worst days. And that's when I was admitted to the COVID unit at Ayr Hospital. I then regressed for a few days after, and it's taken me, I'm 5 weeks post now, and it's taken me this time to recover. Okay, what is it? It's a viral infection that attacks the respiratory and the gastrointestinal systems of the body. It's classed as novel, which just means new. Severe acute respiratory syndrome, SARS, you'll have heard that in the news. It's basically that, and COVID-19 are genetically related. And corona just means crown. Where did it start? It started in Wuhan province in China. A patient presented with unusual pneumonia. The problem with that was it was highly contagious. Nobody knew what it was, and it spread rapidly, affecting the medical staff and everybody else that came in contact with that patient. Okay, so what do we know? 80% of mild cases, and some of these are asymptomatic, which is really good. It means that the majority of the population haven't been affected or will not be massively affected by this illness. However, the potential is that they could carry it to the vulnerable people that are. That's why we're on the lockdown. 20% have moderate to severe cases. I was a moderate case. I didn't go to severe. And the good news currently is that it's less than 3% that are taken to severe cases within the country at the moment. So it's looking good. Further patients admitted develop what they call acute respiratory distress syndrome. Okay. And most cases admitted to have some signs of pneumonia. Okay, and there's ongoing research currently. Okay, so let's look here who's most at risk. Older population, 70 years old and above, and people with underlying medical conditions and autoimmune disorders. Why is that? Because the virus affects your immune system, and as we get a wee bit older, we're more prevalent to have underlying health conditions. Hence the reason these people are being shielded at the moment, because they're most at risk of suffering from this condition. The virus doesn't discriminate. It affected me. I'm a healthy 46-year-old individual. However, only a small percentage of these people will be affected, and the majority will recover. The median age group, 49 to 56, with the population I looked at, and the clinical studies some of them showed that males are more prominent to this disorder than others. Here's a slide showing in relation to what percentage of effects and symptoms that people had. Peruse it at your own time and see how you go. Here we look at symptomatic timelines in relation to how long the virus lasts, how long it's latent, the infectious period you have it. If you look at basically from days 5 to days 15, that was within my timeline. So the only thing I disagree with this one is it says resolution of symptoms 15 days post case, which is taking me a bit long to recover. Okay, so let's look at the testing. The majority of people that were tested in this country were either people that were admitted into the hospital or people suspected of having COVID who were frontline NHS staff. The majority of the population weren't. However, I'd have to say at this point that 25% of the test showed a false negative on first test. Okay, clinical study by China shows that patients produce negative tests initially. However, retested 5 to 13 days later, the proportion of the people had positive tests. Okay, so here we're looking at physiological pathology of COVID-19, what it actually does, what effects it has on your respiratory system, and I've added a wee bit in about myocardial trauma in some cases as well. Okay, most of these physiological effects will resemble SARS and MERS. Okay, I selected this slide because this is one of the few studies that actually took patients and CT scanned them continuously during their when they were in the hospital. So they did a 0 to 4 days, a 4 to 9 days, a 9 to 13 days, and 14 days on. And each level, there were significant changes within the lungs of the patients that had been infected with moderate cases of COVID-19. However, I've taken these 2 points and I've put them down due to the fact that this crazy paving pattern consolidation within the lungs was identified from 5 days onwards and continued up until 14 days. And the good news is that most of the patients all showed improvement after 14 days, where the absorption and healing times extended beyond 26. I found this side very relevant to me personally, and some other people that I spoke to in relation to the anxiety that you get with this illness. No, I didn't realise at the time that the neurotoxicity of the tissue affected your central nervous system. Nobody actually tells you that, and it does. Here's the symptoms there, and I was in the butcher's not that long ago when I walked in, and they were asking me how I'd recovered, and I said, I suffered massive anxiety, and it turns out that he did as well, and some other people that I know have, and the reason for that is because of what it does to your nervous system. Very interesting papers, very interesting information. So I've taken that information, I've backed it up with case studies that showed basically 214 patients with coronavirus being checked for neurological symptoms. And you can see roughly about 40% have had effects to the central nervous system. Okay, so what does it mean in layman's terms? I like breaking things down to plain English, taking the medical side away from it and put it just down so that you can just understand what it is. Basically, the virus creates an acute trauma to the lungs. It impairs your ability to exchange oxygen and carbon dioxide, which is a day-to-day basis you take for granted breathing in and out. Okay, this in itself creates this condition called hypoxemia, where your tissues that you normally get are deprived of oxygen. Okay, so if you look at the signs and symptoms that you get, some of them are related to oxygen deprivation within your tissues. Okay, there is a potential trauma to the heart. In some cases, it has been seen, and there's more evidence to support this, that there is myocardial damage done with the effects of the virus. Okay, it definitely affects brain and central nervous system function. So if you're anxious, you're anxiety, you're not normally like that, you can relate that to the effects of this tissue. It creates a neurotoxicity within your tissues. And we have to look at ongoing chronic pathology within the cardiorespiratory system. However, it can only be compared to SARS and MERS at the moment, because there's no other information. Healing times, I put this in. I put it in to look at so you know that you do heal when you go from a minor case to moderate case, and severe will take a bit longer, depending on how symptomatic you are, will depend how long you're going to heal for. But we need to put them in so you can understand how long it takes to recover. Okay, this is a really good paper, and it basically is looking at lung health because we're looking at a respiratory disorder. I have put this paper in that gives you an indicator that your tissues are damaged, they have to repair. After that repair process, they remodel, and then further down the line, they regenerate. Okay, here's my advice. Okay, simple stages. I've just gone, right, what we want to do, follow your NHS guidelines, hydrate if you have a fever, especially with electrolytes. The reason you do that is that I basically come from a sports science background before I was a physio, and I was working with putting athletes into Beijing Olympics, and we were testing them in a lab, creating a highly humid environment so they would dehydrate. And basically, when we tested them with their effects post-activity with water alone and with electrolytes, the performance and their ability to recover was better. Rest and relax, especially with increased anxiety, and stop watching the news that might upset you, and social media can add to the stress of this. Here's my wee first aid toolbox that I've put together for myself, and some people advise, what can I do? And I just say, look, I'm not a doctor, but however, the information hadn't had the experience of the illness, I've put together a wee kind of toolkit that you can measure your own symptoms. So call 111 999 if you suddenly deteriorate or experience. This potentially happens at day 7, and between that and day 14 when there's increased chance of second stage pneumonia. Okay, now my number one red flag is breathlessness. Not a high temperature, not a cough. If you become breathless and you can't breathe, and your breathing is completely laboured in relation to what it normally is, you phone 111 or your GP, or in extreme cases you phone 999, get advice. Put a thing in here, just check your pulse, easy to do. There's a wee diagram below that will show you what to do, easy. Okay, monitor your breathing. An average adult breath per minute is 12 to 20 breaths. You can look at how you're breathing, always relate your breathing to how you're feeling. Okay, check your temperature. If you're hot, you're generally hot, but if you're lucky enough to be able to get your hands on a thermometer, then you can check, and we normally sit around 37 degrees. Okay, try and rest and relax. This virus does produce anxiety, so watch anything but the news or false reports. Eat, hydrate, and move within limits. Okay, you get these wee things called oximeters. They help measure oxygen. You can get some on Amazon, stuff like that. They're not medically grade. However, they can help measure in some cases where you are. I used one to win my period of 2 weeks when I was struggling, and I just measured it, and it helped. I used breathing exercises, which we're going on to next. Follow the guidelines on positional for breathing. We'll go through that in a second. How to measure your pulse. Dead easy, it's there. You can Google it, you can YouTube it, you can get information, but it gives you an indication of what your pulse should be. Okay, let's spend about a minute on this. We've got an advice for breathing and moving. Physios, doctors and nurses for years, people with respiratory symptoms haven't been putting people on their backs. Basically, they use this condition called conscious proning. Conscious proning is where you're lying on your front, your side, you're on your front again, and an angle on your back. When we are lying flat on our back, most of our lungs sit on the back of our back area rather than sitting on our chest. So what happens with this condition and having the experience that I've had, it puts pressure on your front. You're finding it hard to breathe. So adapting these positions has been shown to increase your oxygen saturation levels within your tissues, and it's really important to do. The other thing I would add in, I know there's videos where you do increase sharp breathing into your chest and hold, but the most important thing I think is getting any oxygen in, even if you can just breathe in and think about breathing into your stomach and just try and relax your breathing in any position. You can do, obviously, if your breathing becomes massively laboured, you phone 111. Here's my advice post 14 days with minor to moderate cases, only because people kept asking me. I know you've had the symptoms there, maybe a week ahead, and with this, people measure days and weeks. Right, you'll be fatigued because your nervous system is recovering from the viral infection. It affects your central nervous system as well as your respiratory system. You'll be breathless because your lungs are still recovering from the trauma that you've had. Your tissues will be weak because they've been starved of oxygen. You'll have a headache. We'll just touch on this. If it's relentless, if it's a relentless headache, let's say 24 hours a day that hasn't gone away, you have weakness in your tissues, disabilities in talking, changes in the visual cortex, then you need to get checked. This headache is relating to either dehydration or hypoxemia. Okay, so just look at the symptoms you've got. Anxiety, we have neurotoxic impairment in relation to what happens within this. So you will have anxiety. It's completely normal. Get yourself chilled out and relaxed in any position. Seek support. Okay, I've put this slide in for education for the purposes of when I can go back to exercise. Now, it depends on how symptomatic you are in the first place. If you're minor symptoms, you'll recover faster than somebody with moderate symptoms. Somebody with moderate symptoms will take quicker than somebody with severe symptoms. And if you've got severe symptoms, it's just common sense. However, you have to make sure that you understand it is a respiratory disorder that can potentially have effects in your cardiac system. So you need to take into consideration what you can look at. If you're a personal trainer or somebody that prescribes exercise and you've got patients, we need to be aware that they could have these systems that have been affected and it takes longer to recover. What can we look at? We can compare it to SARS and MERS. We can look at stages of pneumonia. Definitely look at stages of healing, especially with respiratory trauma. And you also must take evidence of cardiac injury because there is a small percentage of people that are affected by this condition. My personal advice, always listen to the medical professionals in NHS. They're absolutely brilliant. They have been brilliant with me. I know they've helped other people. Man numero uno, if you become breathless, 111, 100%. That is a clear clinical indicator for me for you to contact Treble One. You need to rest and recuperate. It takes a bit of time to recover from this virus. Monitor your symptoms. I've given you details on how to do that. Breathe in heart rate and temperature. Hydrate with electrolytes and water. I've told you why the benefits are. Far better with electrolytes and combined with water than water alone. Always start with low-level aerobic activity. It's a respiratory disorder. It affects your cardiovascular system. Okay, so we don't know what damage. So look at what manage your people. Don't be crazy and doing high-intensity exercise. Don't get people straight back out running after this. Don't be getting them back to the gym lifting massive amounts of weights. Start with low-level aerobic activity. Build up from there. Be sensible. Look at the stages of healing. You'll understand why I put that in. Seek support for mental health and anxiety related to COVID-19. I had anxiety. I didn't know why I had it. It's because of neurotoxicity within the tissues. Seek support. The best thing that happened to me is a girl around the corner had started this group called COVID-19, You're Not Alone. Happened to come across it. Loads of people in it with similar symptoms. There must have been at least 10 or 15 people. And even today, you can look at people texting and saying what these, but week on, you get better and better and you start to improve. You can look at how it affects you, what the symptoms are, and I would highly recommend it if there's a support group near you that you find one. Okay, I put this slide in because my phosphate levels were low when I went in. Phosphate levels are closely related to vitamin D. So read this, and all I'm going to tell you is I live in the west coast of Scotland. I work in a busy clinic. I don't see a lot of sunlight, and I would highly recommend that anybody in a similar situation takes vitamin D. Here's the evidence to support it. And most importantly, don't trust everything you see or hear on social media. All the information I have taken here, I have taken from journals, peer-reviewed journals, medical journals from the net. I tried to get the highest evidence that I have. I can only thank my lecturers at Calais University in Glasgow for giving me that education. And I have put together information that I think is valid and relevant. Thank you.